are excited for those in this room, those that will join us virtually as well as recorded. I'm Sheri Brownlow, Director of Parent Family Programs, and I am just excited to bring this esteemed group together, these awesome officials at our university who will speak to you tonight about their programs, their initiatives, everything that they do to serve our students for their health and their wellness. And with that, I'm going to pass it off. I'm going to get each one of them to introduce themselves and to tell us a little bit about what their area does to serve students here at the university, and then we will take it from there. We'll get Lindsay to start us off.
Awesome. Well, I am Lindsay Montgomery. I'm the Alcohol and Other Drug Prevention Education Coordinator for the university. My position is housed within the Center for Young Adult Addiction and Recovery. And so what the Center for Young Adult Addiction and Recovery does is we provide recovery support services for students who are in or seeking recovery from substance use disorders, eating disorders, as well as process addictions. And so we have a wide variety of academic and social support services available for students who are in or seeking recovery. We also do a lot of alcohol and other drug education across campus, and we also have research teams that focus on recovery science research. So we're kind of in a lot of different areas across the university supporting students in a lot of different ways.
Hi, I am Dr. Josh Gunn. I'm a psychologist, and I oversee the counseling center here on campus. And at the counseling center, it's a pretty robust place where we really strive to support student mental health kind of across the spectrum. And so we do a wide range of things, everything from educational programming and workshops on things like managing anxiety and depression, on procrastination, test anxiety, and really just trying to give students information to help them just make good decisions and give them the skills they need to be as successful as they can be as students. But then we also obviously do counseling as a counseling center. That is probably the bread and butter of what people know us for and think of us for. And so we have a pretty good sized staff of clinicians, of social workers, counselors, psychologists. We have psychiatrists who provide mental health services to our students. We know that college is supposed to be stressful, and it is, and so we're there to help them with that. We're there to make sure that it doesn't become overwhelming, hopefully, and just support them in any way that we can through that. And so, we do individual counseling, we do a lot of group counseling, and it's one of our favorite things that we do, because our group counseling efforts help students who are kind of maybe navigating some of the same spaces together or struggling with some of the same things. And so there's a wide offering of those things, dealing with everything from just general struggling, maybe adjusting to college, maybe they've experienced some traumas in their life, or just other experiences in the environment that are causing stress. So we really like to get students in a room together to help them kind of support one another, and find that students really do enjoy that part of what we do. But we also do other things, like we have a case management program that is really geared toward helping students who just maybe have some complex needs or really need coordination with some help across either campus or on campus, things like that. And we also, because we have in-house psychiatric providers, we can also do medication management for mental health conditions and things. So we really are a kind of one-stop shop here on campus to support student mental health and well-being.
You're a tough act to follow. Hi, I'm Julie Fritz. I'm the practice manager for the student health clinics on campus. There are 3 clinics. There are 2 on the Kennesaw campus and 1 on the Marietta campus. We want to be the primary care provider for your students while they are here at KSU. We are basically primary care plus. So anything you would see a primary care provider for, as well as if you've got urgent accidents on campus. We do have some walk-in volume on a daily basis and same-day availability for just well checks. Anything that they're seeing a physician for at home, we want to see them for. We also have 24-hour response if something happens at night. They call our number at the clinics and they're able to speak to one of our board-certified physicians and nurse practitioners to kind of help them navigate through what they need to do before we open up the next morning. And in most cases, we can see them the following day and save them from having to go somewhere off campus for care. We also have an embedded licensed counselor in our clinic. So if they come into our clinic and we've seen them for a well visit or a sick visit, and we identify that they also need some support while they're on campus, we kind of work in the clinic to work with them and then get them set up to visit Josh's group across. We also do a lot of outreach on campus. Times of year that our highlights would be the flu season. We do flu shots on campus, give free flu shots, do big events, and most recently we historically have given over 20,000 COVID vaccines on campus to students as well as faculty and staff.
Hi, I'm Tara Parker, the Executive Director for the Department of Sports and Recreation. And so we offer programs, services, and facilities for students to recreate. We promote well-being, we promote healthy lifestyle habits, as well as physical activity in its many forms. And so students come to the facilities to work out, or they can participate in programs like intramural sports, club sports, outdoor adventures, our aquatics programs, as well as fitness programs. We also offer services, so if you would like personal training, or you're looking for some swim lessons, or you would like your bike to be serviced, we provide those services as well. And then we do special events such as Turkey Trot and Daffodil Dash. We did a homecoming boat race the other day, so had some students race their cardboard boats through the pool, and got a lot of audience participation in that as well.
Hi, my name is Sheri Grebel, and I'm Director of Health Promotion and Wellness. And we provide programs and services to keep students healthy. Healthy students are better learners, and so that's our goal. We have 4 different signature program areas, one of those being peer health education. So we recruit students of all majors who are interested in health, passionate about health, and they go through a training with our department, and they receive a national certification, which is a great way to build your resume and get connected with other students on campus. And they help us do outreach on programming, so tabling. Next week we'll do Fall Festival as part of National Collegiate Alcohol Awareness Week, just a variety of different programs like that, so it's a great way to get involved. We also have a dietitian on staff, so we have nutrition services. Students can meet with a dietitian one-on-one for a wide variety of reasons. Could be just general healthy eating, or if they have a chronic condition that they need help with, she can do that. She also teaches some cooking demonstration classes, which are very popular among students. So you learn how to prepare healthy, budget-friendly meals at home that's easy to replicate, very tasty, so they're really good. A new program we just recently offered is wellness coaching. And so again, we utilize students, and they go through a training, and they're called wellness peer mentors. And they help students that are struggling in different areas, see if they need extra help, like maybe peer support in starting a physical activity program, or quitting, nicotine, those types of programs. What else is there? Stress, emotional health, here I'm forgetting everything. And there's one more, emotional well-being. Another area is just general health education programs, and so we offer programs such as CPR, first aid trainings that students can receive. We also do health fairs and a variety of different programs to keep students healthy.
Hi, my name is Jessica Aguirre, and I'm the victim advocate at the Office of Victim Services. Our office is a confidential and free service, an office that offers support to victims that are to students that are victims of crime. The crime doesn't have to happen on campus in order for us to assist. We travel all over the state, sometimes with students if they need assistance with filing protective orders, reporting to the police. We also assist with sexual assault exams that are also free. We are always available. We have a 24 hours, 7 days a week, 365 days a year crisis hotline, so we are always available for students. I don't, did I mention we're confidential? Sorry.
You know I will.
I know. We are confidential, so even though we are under the Department of Public Safety, we are completely confidential. A student never has to, what our office does is we empower the students to make the decision that is best for them. Most of the crimes that we work with are sexual assault, intimate partner dating violence, stalking, and domestic violence. So those are some of the crimes that we assist with. But we also work with students that are victims of theft, any fraudulent activity on their credit cards or debit cards, and then any else assault cases as well.
Awesome. So Jessica looked at me because we kind of fall under the same umbrella of the department. So my name is Charles Dickens. I'm a sergeant with Kennesaw State University Police Department. I'm with their community outreach unit. So under the Department of Public Safety, there's 3 main offices. There's police and security. There's Office of Victim Services, and then there's Office of Emergency Management. So since Jessica did a great job talking about Office of Victim Services, there's just one thing, I won't go into that much more, but I do want to say one quick thing. So when she said they're confidential, basically what that means is They may be working with students who are victims of crime that we have no idea who they are, because the student went directly to them to get assistance, maybe with getting direction to counseling, psychological services, or maybe they want more information about what their options were as a victim of a particular crime. We may not know who they are because that's confidential and they haven't decided they want to report to police yet. However, anybody who reports to us that they were a victim of a crime automatically gets referred over to them. So they know everybody we've taken reports for when it comes to people who are victims of crime, but we don't necessarily know individuals they're working with, because those individuals may have decided they did not want to report to the police, which is their right, and we want to make sure that they're empowered. So that's why, you know, they're such a great office. So moving on, we have, like I said, we have Office of Emergency Management, and what they do is in the name, they manage emergencies. So one of the big things that they do here on campus is they have crisis coordinators who they train. All the buildings on campus have crisis coordinators, and what those are, they're individuals, they're staff or faculty members who are in each, you know, their respective buildings, and they have radios that are connected to our Office of Emergency Management staff. So if there's, let's say there's a fire alarm going off on campus in the library, the crisis coordinator can get on that radio, notify emergency management, who can in turn notify us. So it's just to, you know, make sure they're also trained in how to respond in particular emergencies. So if there was a fire alarm going off, they know where the exits are, how to get those folks to the exits, proper protocol, and things like that. And they also, like I said, they manage emergencies. So regardless of what it is, if it's man-made or natural disaster on campus, COVID specifically, they've really shined a lot with that. Our Director of Emergency Management actually just won an award through the Cobb County Chamber of Commerce for his role in making sure the university was prepared to respond in the way that he did. And then anything else that you can think of, they have a lot of great equipment over there to make sure that the university is prepared to act and respond. Then we have the police department. So under the police department, we have police and security. So we have patrol officers, and we are 24/7, 365, just like OBS. We have officers on both campuses at all times, night, day, holidays, closures, weather emergencies where nobody else can commute, we're here. We also have security officers that will be here with their particular patrol team. There's officers on both campuses. They have their respective campuses. And then we also have our communications center, which is also available 24/7, 365. All of our emergency and non-emergency numbers go to the same place, which is our dispatch communications center. And they get those calls out to our patrol teams. We also have criminal investigations under the police department. We have special operations, who's responsible, I always joke and say they're responsible for shutting down the road during football. We have our 2 bomb detection dogs housed under that unit. And then what else? Did I forget anything? I know it's a lot. But we are here. We're available at all times. If you have any questions, you can always reach out, and I'm going to get to the rest of our stuff later. So.
Hi, I'm Marcy Stidum. I'm the Director for Care Services. CARE provides support to students who are experiencing some type of financial hardship. So we're mostly known as the home of the campus pantry. We have a pantry on each campus. And the pantry is open to any KSU student. They can come twice a month and shop, and pretty much it's unlimited shopping, just on select items it's not. We don't want students to have to worry about food, and that be the difference between being able to afford KSU or be a continuous student. We want to, like Sheri said, we want them to be healthy so they can be great students. But then if a student is experiencing homelessness or foster care or any type of severe food insecurity, we have case managers that we work with the School of Social Work, and they provide support to them and basically help them navigate and find a way to get financially stable and or safely housed. Then we also oversee emergency assistance that's open to any KSU student as well, and that service is provides support during if you're having some type of unexpected hardship. So we've had students get their off-campus apartment burned down. We have had students had unexpected car issues. Or also we have students who are trying to get accommodations and they can't afford the cost of the test. So those are the different things that would directly impact them being able to be a successful student, and so we provide those supports to them. We also are the home of Americorps Vista, which is, if you know about Peace Corps, they impact poverty globally. Americorps impacts poverty domestically. And so that's a place for students to come and get paid volunteer opportunities for 10 weeks, or if they're doing a gap year, they can do a full year with us. And it becomes a great launching opportunity for them when they finish, because they get a large amount of money also to go toward the student loan debt, but then they also have specifically the 1 year gap year opportunity those students go on and have opportunities to be treated like almost like a veteran, and have that same level of status when they apply for federal jobs. So we've had a lot of students leave from us and serve a year and get great jobs in the federal governmental system. And then also we provide, through a statewide program, we provide support to homeless and foster care high schoolers across most of the state of Georgia, and provide them resources and support. And that's it. Just pass it.
Thank you. Families, if you can't tell already, these are individuals who are not only just amazing rock star support offices on our campus, but they're known nationally. They're award winners, they do great work. They really, Kennesaw State University is a thriving, amazing, large, small in some ways, supportive, and these are all stars that are at the service of your students. So we are so thankful to have them each here representing everything that they do. For this next question, I'm going to actually put two questions kind of together because you guys kind of hit on a lot of it already, but I do want to specifically pull out what steps should a student take to get involved with your office? And then in addition to that, are there any leadership employment opportunities? So how do they get involved, and maybe that extra step of employment as well?
Sorry, I sat in a very awkward place where we get to do a fun microphone pass. So with the Center for Young Adult Addiction Recovery, we have a few different ways for students to get involved. And so any student who is, like I said, in or seeking recovery can be a part of our collegiate recovery community or our collegiate recovery program. But then any of our allies, right? Because we have allies across campus who support what we do. Students can get involved in our Center for Young Adult Addiction Recovery Ambassador program. And so they can come out, volunteer, and gets volunteer hours through BKSU, but also serve as liaisons from our center to other students to be able to provide alcohol and other drug prevention education work across campus. That is a really new program that we just launched this year, and we have some wonderful ambassadors, and those students are making a huge difference across campus. And students can find that on Owl Life. Shameless plug. And then the other way that students can get involved with our office is actually through our peer education. And so our office does peer education where students have the opportunity to get trained in alcohol and other drug education and go into academic spaces, into classrooms, and be able to present to other students as well. And so these are all great volunteer opportunities for students to get involved. And then we have a student leadership within our collegiate recovery program as well, which is phenomenal, and our student leaders they just surprise and impress me every single day.
So in the counseling center, this is really two-pronged for us, right? There's folks who want to get services from our office, and we try to make that as easy as possible. Students can walk in, they can call us, they can shoot us an email. Any of these ways you can kind of get set up for an initial appointment to come in, talk a little about what's going on, and really just get connected to us. Since we're talking to parents tonight, what I will say is you cannot call for your student to get them set up with us, which we share with multiple students every day on the telephone and stuff. So just wanted to kind of throw that out there. It does require your student, who is an adult, to contact us and set up service. But the flip side of that is the things that students can get involved with us, because a lot of students, psych majors, human services majors, things like that, are always asking us how can we get involved. And we're really proud of our student advisory board that we started several years ago that has become a very just helpful and robust group of students who represent our office all over campus. We know that when we want our office out there talking to students can do that better than us professionals sometimes. And so they represent us, they do presentations on kind of topics around psychological health. They do some academic coaching for things like procrastination, test anxiety, study skills, things like that. And so students who are undergraduates who want to kind of get connected to our office and do some service of mental health in the community can join our student advisory board.
So the student health clinics are a unique service on campus in that we are operated and staffed through the WellStar Health System. That gives students access, if they've ever utilized the WellStar Health System, to make appointments and communicate with our providers through the MyChart application. They can also use ZocDoc, which is an app on a phone, as well as call or walk in for appointments. We are an appointment-only clinic in all 3 locations, but on any given day, we have same-day availability. So we always say that our mornings look like we might not be busy, but we fill up by the end of the day. And that's the nature of student health. They're very busy on campus, so we want to be available to them whenever they realize that they need us. As far as opportunities for employment, we do not have employment of students in our clinics because we want to maintain that confidentiality for their peers on campus. We do have intern possibilities for public health majors, and in the nursing program with the Wellstar School of Nursing, there's clinical rotation opportunities for nursing students. We also have clinical rotation opportunities for CMA students, nurse practitioners, and we also work with the GME clinics with Wellstar for rotating residents that are becoming physicians.
Students can access the rec centers on each of the campuses by using their Talent One card. On their first visit or even before they come to the rec center, they can go to mysportsrec.kennesaw.edu, log in with their net ID and password, and there'll be a waiver form that they'll fill out. And then that website also allows them to sign up for different programs, trips. So if you're interested in intramural sports, you can sign up through that portal. If you're interested in club sports, the same thing, as well as fitness classes or personal training or a nature-bound trip. When you come to the rec center, you'll have your Talent One card. It allows you access into the facility to utilize at your own schedule. We have operating hours Monday through Sunday, various hours throughout the week, but our website has all the information that you need in terms of what we offer, our hours for the facilities, as well as upcoming programs and activities that we're going to be offering. In terms of employment, we are always looking for students to help us facilitate programs and work in the facilities. We rely heavily on student employees. They are very important to our operation. And so we offer positions from sport officials to lifeguards to nature-bound trip leaders, various capacities throughout our facilities as well as our programs. And so if you're interested, again, information is on our website. You can also stop by our office. Our admin office is located in the rec center here on the Kennesaw campus, 1100 suite number, and we'll be glad to help you. And then our leadership opportunities, again, through some of our programs, like our personal training, they go through a leadership development to become personal trainers for us, as well as our group fitness instructors. Our nature-bound trip leaders also go through an adventure leadership course to lead trips, and I think that's it. So.
For students to get involved with our office, the best thing would be to visit our website, wellness.kennesaw.edu. There, it's kind of a good, everything is there in one spot. They can also stop by our department. We're also located in the Student Recreation and Activity Center on the Kennesaw campus. They can email, call, and follow us on social media. There's also a new initiative on campus called Wellbeing at KSU, and that consists of several of the departments that are on the panel today. And so it's a broad initiative, so it's a great way to stay involved with everything that's going on campus. So that's also another social media following you can have. To get involved with our departments, we have the peer health outreach, like the peer health educators or our peer health owls. Again, it's a great way to get involved and get connected, as well as being the wellness peer mentors who provide the wellness coaching. We're currently hiring for student assistants in our department, so if your student is needing a job, send them our way because we really need the help. And we also take interns, typically from public health majors, or as well as communication to help with our social media.
So some ways that a student can reach out to us is they can call our crisis hotline, which again is available 24 hours, 7 days a week, 365 days a year. They can also email us at obs@kennesaw.edu. They can also reach out to us by calling the Kennesaw State Police Department through the Live Safe app. They can also reach out to us on our social media, and a lot of the partners that are on the panel with us can also direct your student to us if they are in need of our services. The student doesn't necessarily have to decide or know what they want to do before they reach out to us. They can just come to us as the first point of contact to just really realize and talk about what's going on, and then from there we will give them the options to see what is the student would like to do or what is the best decision for them. Another way they can contact us. No, okay. Again, because there's so many ways the student can reach out to us. We don't have any employment opportunities at the moment. We are thinking about getting an intern, so if that is something that you know that you or your student would be interested in, they can reach out to us again at our email, which is obs@kennesaw.edu, and then we'll be happy to speak to them. Thank you.
Yeah, so we also don't have any paid opportunities for students. However, we do offer internships every semester. We post our internships on Handshake, and the student can go access them there. They do have an open and a close date, so if that's something they're interested in, we have opened that up right now for the spring semester, so they can go on there and put in their submit their application for that. As far as getting involved with our office, we do have a few signature programs that we offer, which I'll talk about in a few, but as far as like the independent outreach, they can always contact us through calling our numbers. They can email us. They can find all of our information we're talking about here today on our website as well as on our social media accounts. But there was one thing I was going to say. I forgot to, Sharon. I'm so sorry. It just left me. But it was a good one. But I'm sure I'm going to come back to it here in a second. So yeah, absolutely reach out. Oh, that's what it was. I just remembered. So any independent outreach, that's what it was. It's a late day, y'all. So any independent outreach. If the students have any concerns or issues and they would like to request any type of engagement with our officers, whether it's presentations, roundtables, town halls, we'll always partner with individual student groups or individual students to host or co-sponsor any event they might be interested in doing, just to provide that additional support that they need.
So for my office with CARE, the best way for students to access our services is go online to care.kennesaw.edu and then click KSU Cares, and you'll see where you can go online with the pantry. Our pantry is kind of like an Instacart. So you can order your food online, and especially if we do this for our student parents or our grad students, if they order their food online and can't come during pantry hours, we have it set up, we can put the food in the post office boxes. And the post office will let us know when those items are picked up. To do that though, you can't get any items that are out of the pantry, freezers, or refrigerators, because we do have ice cream, so we won't put that in the box. But anything else that's shelf stable, we would. And then also if you want case management services, because you're having some housing insecurity issues or different things like that, you can also schedule that appointment online. Right now it is through the same system you would use for advising, which is Navigate. But then if you wanted to work with us, just in our KSU Cares and our emergency assistance, we have about usually between 20 to 25 different positions for students. And that's internships. Most of our internships are master level for graduate students, but we do a lot like with communication majors. We let them come in and be our digital managers and manage all of our digital media and how we promote our services to students virtually through social media, YouTube, and so forth. And then also, all of our pantry staff are usually federal work study students. And so all of our federal work study students manage the pantry on both campuses. We have a great team. We just filled up our positions this week. So we're excited to have our full team of 5 on that one. But then we also have students who help us in different areas, like with our Care of Georgia program, which is our statewide program, as well as with Americorps Vista. Then specifically with Americorps Vista, I hinted to it earlier, but we have 30 positions just for that program alone. 10 are 1 year. And so those are usually people who are want to do a gap year. But those other positions out of that 30, the other 20 positions, and we're going to get an extra 5, so we'll actually have 35 in total. So 25 positions this summer are for 10 weeks. Students get paid about $600 every 2 weeks, and at the end of the summer get $1,300 to go pay down your student loans. Again, that looks really good on your resume. It is equivalent, if not, it's equivalent to like seeing like an internship, but if you're going into the governmental world, it's seen a little bit higher because that showed you worked for the federal government and you've had that type of experience. So I just literally was talking to a student in the hallway who's graduating in May and was asking how could she be a one-year Vista or work with us this summer. And so I was telling you could probably do both options because we've had somebody do that this summer. So we have a lot of great opportunities, especially we do a lot of things with public health, public administration, Crim Just, Health and Human Services, and then we're also looking at retail management degrees, different things of that nature, because again, we do run a store.
Thank you, guys. That was a lot of information, but such great information about how to get involved. Some great employment opportunities for those of your students who are maybe not yet employed, but maybe thinking about getting a job on campus. So many great options that they just talked about. So now I know some of you, when you introduced yourself, you did talk about privacy in your office. And so if that applies to you, so essentially how does information sharing with parents and guardians work in your office? So if that applies to your office, if you'll kind of take the mic and pass it down and give us a little bit of information about that.
Oh, actually. So with our collegiate recovery program, we are a confidential program, and so we're not going to tell anybody that the students came seeking out services. We do have a clinician on staff, and so that is bound by all the same clinical standards for confidentiality and privacy and everything. And so we do have parents who will call our office every once in a while and like, my kid needs to be in your program. And until the student reaches out to us directly, we're kind of like, you should tell them to get in touch with us because there's nothing we can do until they do, because they're adults. And so that's ours works very much like Dr. Gunn was talking about with the counseling office. Like, we can't really communicate with the parents. The students have to reach out to us until they give us any kind of indication that we can talk to family members.
So I'll talk about us, and you can jump in if you want to. So obviously the counseling office, the student health center, these are medical providers, right? Mental health providers, medical providers. And so we always kind of operate under kind of the guise of doctor-patient privilege, which basically says once your student is 18, they're an adult, they have to both initiate services, all the information related to any services we provide to them, obviously they own as that adult. If they want that information to share with you, kind of like she was saying, they can sign something that says, please communicate with my parents, and they can specify what we might be able to share with parents and things like that. But we aren't able to just be like, you know, if a parent calls and be like, has my kid been there? Like, I can't talk about that. That's their health privacy and things like that. The other thing I was going to say, and I can't remember what it was, I lost it. And we do have a lot of dual enrollment students and even 17-year-old students. So any student has to have parental permission to receive treatment just like they would if they went to any other kind of medical practice or facility off campus. What'd I miss?
I think ditto all that. In student health, same thing. If they're over the age of 18, all of that information is kept completely confidential. As well as we don't let them do kind of a blanket release when they arrive at KSU and say, anytime I'm here, mom and dad can get my information that I was here. We do that on a case-by-case basis, and each time they come in and they meet with a physician or nurse practitioner, they're asked, you know, do you want this information shared? And by all means, if they want to share information, we recommend they share it with a parent. But by all means, if they want us to share it, our providers are always happy to make a phone call and touch base with the parent with their release. Under the age of 17, if they come in, or under the age of 18, if they come into our office, we immediately, we get them in a room, we triage them, and we call a parent to get consent before they're provided any kind of treatment. The only time that wouldn't happen would be in an emergency situation. And typically we'll get things rolling if they're in an emergency situation and reach out to a parent kind of simultaneously. So if something was happening in an emergency and you happen to be at work and you don't answer your phone because there's this weird number coming up from student health, by all means, we're going to take care of your student, but we're going to reach out to get that consent to get their care taken care of.
For Department of Sports and Recreation, we provide general information to parents. So if you call just to find out about different activities and things that we have going on, we can provide that information, but otherwise we follow FERPA and HIPAA when it comes to private information.
And my department does the same. Health promotion and wellness information is confidential unless the student signs a release, then we can share that information.
I'm just gonna pretty much mirror everything that everyone else has said. If a parent does call, the only thing we can say is I cannot confirm or deny that we're working with a student. So the only other reason that we could speak to a parent is if the student allows us to. And every time they come in with us, if they do come in and speak to us as a student, we always double check with the student to see if that is something they would like us to share with the parent, if they gave us permission at one point. So we always check in to confirm and to make sure that they are comfortable with us sharing information.
So, with the police department, I like to think, live by the thought of you can tell us as much as you want, but we can't do the same in return. That's like a blanket statement, but basically, like, I'll give you a scenario. If you hadn't heard from your student and you had some concerns and you called us for us to go out and do, some people say wellness check, some people do welfare check. I know I spoke with some of the parents earlier today about that. We'll take all the information you want to give us, and we'll take that into account when we go out there and check them. But, you know, if there's something going on, they're over 18, you know, we are not going to disclose all that information to you if you call back up there. Also, a different type of situation is if they have an open case going on, regardless of what their role is in that, you're not going to be able to call up there and we're going to give you all the details of the case and tell you where it happened, who was involved, and how they were involved. That's up to them to tell you because they're 18. We are subject to open records, so when they talk about confidentiality, we operate a little bit differently because we are subject to open records. But there's going to be things that are still not going to be available to you, and there's a process for you to do that. We can't just tell you things over the phone. So.
And I'm very similar to CJ with our area. But what I will say, we do get a lot of cases that we share with OVS, and so we partner together because we are the place where students who are experiencing homelessness can come. One of the things that fall under homelessness is family or domestic violence. So a lot of those times we partner together to make sure students are safely housed, whatever that means and looks like. And so we partner together on that. So we always defer to their rules. When we're working with counseling, we defer to their rules. But again, you can tell us anything you want to. We may not share information back. We do get a lot of dual enrollment students as well. So we partner with them if they have housing issues. In those scenarios, we work with the schools. And so we partner with the dual enrollment coordinator here. And then in that partnership, we go back to the schools and work with the school social workers there and give them information where there may be concerns about. Usually it's around violence and family, domestic violence issues and different things of that nature. There are opportunities in rare moments where we may have a homeless family unit. And so what we do is we focus on the student first. And then if those student benefits, if those student services that we provide to that student benefits that family, then that's fine, but we focus on the student first. Because sometimes students are homeless in high school, they are very smart, they're very capable, and they come to college, but the whole entire family unit may be living in their car. And so we understand that, and we don't want to discriminate against them, but we do want to make sure and understand that our resources are focused on the student.
Thank you guys. I know that is a hard question to sometimes answer and address, but you all did it so wonderfully. And I know families that absolutely, CJ, I love it when you always make that comment. You guys can tell us anything you want, and that can be really helpful sometimes. And these guys on the flip side, they can tell you general information about their offices, about their services, so you're always welcome to call. There's just some limited information depending on what that is. So we appreciate your answers in that. So last question, and I'm gonna, again, kind of put the last two questions together for the sake of time, but talk a little bit about your some signature events that you get really excited about, and what students should be on the lookout for. Maybe some things have already happened this semester, maybe things to look forward to. We are here in the month of October. It's a big programming month, but there's so many more things to look forward to. So tell us about signature events, and then maybe give us, right as you end, a really cool fun fact about your department that you're like, not everybody might know that about our department. So with that, that'll end our questions, and then we'll go from there. So here you go, Lindsay.
So coming up is our Hoodie Boo Halloween Karaoke and Costume Contest, and so that's my favorite event of the whole year, because who doesn't love karaoke, right? And so that's just an opportunity to get a bunch of students together, have a really good time, provide some programming that is fun and safe during a typically pretty high-risk time of year, right? And so that's coming up. We do a lot of programming throughout the year, but one of the other things that is very popular and we have students participating in every single month is our naloxone training. Naloxone is the opioid overdose reversal medication. We offer trainings through our department at least once a month, if not more. And so any student who wants to participate, and that goes for faculty and staff at the university as well, can come in, be trained how to identify an opioid overdose, how to reverse it using naloxone, and be provided with a free naloxone kit. And so that's a really great opportunity for people to be equipped and prepared for things. And then one of our biggest events of the whole year is actually a partnership with many of the departments on this panel today during Love Your Body Week, where we do so many fun events, and that will be happening last week of February. And so we'll have the Smash the Scale event, we'll have a big open mic night, and so that's really a fantastic event where we get a lot of Wellbeing department participation, and students love Your Body Week.
In the counseling office, the two things we think of as our signature events, besides the services we provide, are in the fall we do a Mental Health Matters Week, and in Mental Health Matters Week our goal is stigma reduction and normalizing help seeking, and really just really trying to normalize that. There's a reason there's a college counseling center on campus, right? There's a reason that we're here to help your students be successful, and there's still a lot of barriers sometimes to that. And so we want to just make sure students know we're here, that we serve students just like the advisors and the faculty and everything else, and really just normalize using us to be the best that they can be. And then in the spring, we do a suicide prevention week. We spend a lot of efforts on campus around suicide prevention. It is, again, college is stressful, it's not supposed to be overwhelming, but we know it's a problem on our university campuses. And so we spend a lot of time educating the community of faculty and staff about things to watch out for, how to respond to students, how to talk. And we also do a fundraiser with the American Foundation for Suicide Prevention to raise money for it, because we really believe it's that big of an important of a just public health crisis, honestly. And then I think that's cool about us, people don't realize there's a lot of experiential things you can do for us. For example, we do a drumming group where students can get on some bongos and really learn how to be just a little bit more relaxed, a little bit more mindful about their things. We do some art programs where students can come and do art projects that help them kind of think about their well-being and stuff. And so it's not just coming and talking to someone on their couch or something like that, like we get portrayed sometimes. There are a lot of experiential things that students can come do and just to learn a little bit about how to better take care of their mental health.
Again, tough act to follow.
So the biggest takeaway I want you to have today is that while they're at KSU, you have already paid for them to use our services in student health. It is one of the fees that you pay for. So when they come in to see us, that consultation is not billed to your insurance, there is no copay, and they can come and see us as much as they would like. The only time that we would have to bill insurance or that there's any charge is if they actually need medications or if we provided some sort of vaccines in the clinic. That being said, big plug for our biggest events throughout the year. Used to historically just be the flu. We would really push free flu shots on campus. We do a lot of 10 events. We do some evening, we're doing a hot chocolate event in the fall where they can come and get their flu shot at no charge. Again, another plug right now, we're giving COVID shots. So whether they've started the series off campus and they want to get their second shot, or we're even providing boosters at this point, reach out to Student Health, get on the Student Health website and the Campus Services website and see all those opportunities to take care of getting those vaccines. Watch social media. The flu events are a lot of fun typically. There's typically giveaways. We want to get as many students involved in those two vaccine efforts right now so that we can keep them safe and we can continue with a very active campus.
A couple of signature events that are offered through the Department of Sports and Recreation. We have our turkey trot that's coming up. It's a 5K road race that's open to students, staff, faculty, alumni, and their guests. And so we are currently taking registration for that. Upcoming, we've got our Outfit Outdoors. They do monthly events where they come outside of the building to bring the activity to you all. We also have our Fall Into Fitness Challenge through our outfit program, glow-in-the-dark cycling, climbing events. We do dyno competition. So it's a climbing competition that they hold after hours and turn off all the lights and climb in with black lights. So it's a fun event. The students always look forward to that one. We do Gravity Check, another climbing event in the spring semester, as well as Daffodil Dash, another 5K that we host in the spring semester. And then we do weekly bike rides, and of course our normal programming as well. All of this information can be found on our website, sportsrec.kennesaw.edu. And then something I think that not many people know about our department or what we offer through our department is for our club sports programs, these students are very dedicated to the sports that they participate in. They travel to various universities across the country, mainly in this region, but some do go across the country to compete and represent Kennesaw State. And we've had some national champions come out of that program as well. And in addition to that, we do have an athletic training service that we provide for our club sport athletes so that we can get them back on the field as quickly as possible if they're injured or they just need some assistance with maintaining their health and being injury-free.
Hi. So with health promotion and wellness, some of our signature events include, like next week we're having our fall festival, which promotes alcohol awareness, part of the National Police Alcohol Awareness Week. We also do the flip side of that in the spring before spring break, so we have our Safe Spring Break Party. Like Lindsay mentioned, we do Love Your Body Week in February, early March. We also host a Run for Recovery 5K. Typically that's held during the week of Welcome to kick off Recovery Month in September. In the spring, we have a huge health fair where we utilize students majoring in exercise science and nursing, and they provide a lot of free health screenings for us. Cooking demos, as I mentioned earlier. We also do free HIV testing and programming around healthy relationships, CPR first aid. We also take a golf cart out on campus and meet students where they are, so we call it Wellness on Wheels, and so we have a variety of different monthly topics. Could be stress management, could be healthy relationships, general healthy eating, just a variety of different things. And we also do free fitness testing in our department. So the fun thing that most people may not know is in our department, stress is a huge concern with students, and so we have an area called the Stress Less Station in our department, so students can come in and just color if they want, play with Play-Doh, do puzzles, just kind of a quiet place to hang out with their friends.
So some of the signature events that we may have is wrapped around like our awareness month. So January is Stalking Awareness Month, February is Teen Dating Violence Awareness Month, April is Sexual Assault Awareness Month, and October is Domestic Violence Awareness Month. So we try to go out in the community and talk to students, and we try to do at least one big event on campus. Right now we don't have any events coming up. We are partnering with other campus or other resources such as the Women's Resource Center to have table events, so we will be out there doing In Her Shoes at the end of the month, and then we also try to do, like I said, just pop-ups here and there of just table events to provide information and resources. A pretty cool thing about our office is that we are one of the first offices of victim advocacy programs that are in the university. So we care a lot about your students. Last year, our office also won the Cobb County Public Safety Award. So we really, truly care about the students. We're always here for them, and we're just an office of 3, but we're really committed to the students and assisting them. So we will do as much as we can to help them.
So a few of our programs that we offer, we have a self-defense class, which is free to students, faculty, staff, and alumni. It's also international, so it's not just here at KSU. And the reason why I share that is because it has a lifetime free return policy. So once you come through our program, it's 4 nights, it's 3 hours each night. We typically do Monday, Wednesday, and then the following Monday, Wednesday, or Tuesday, Thursday, from 5 to 8 p.m. That is a plug, like she said a minute ago, because we have our class coming up next week. If you are interested, you can find the information on our Facebook page as well as our website. If you are a friend, parent, community member, and you want to come, to one of our classes. It's a $25 flat fee, and even though you paid and your student did not, neither of you will ever pay again. That lifetime free return policy does apply. Past that, we have our citizens, so that's coming up. In the spring of 2022, we're going to have our Citizens Police Academy back, which runs for 10 weeks. It is also free. It's open to anyone. It does not matter if you have an affiliation with the university or not, although we do like to get our university partners in there, of course, and campus community members. And then coming in spring of 2023, we're going to have our student training program, which is just to try and help manage mindsets and approach to law enforcement if a student is considering that, and provide them with a little introduction to some of the stuff that they might see when they go to the police academy. Another program that we have that also kind of rolls into something that's really cool about our department, and we're coming up on our 6th year of providing a dinner for students during our blackout period during December. So we have a week where there's no transportation, no dining. We provide a meal for free to students, as well as just a space for them to come and hang out, because a lot of people don't realize we have students that work and can't go home during the holidays. We have some students that aren't allowed to go home, some students that don't have a home to go to off campus, and then we have a lot of international students who come here to start school and they will not go home until they graduate. So there is a need for a place for community, and my thing to say is we'll stay till the food's gone, and then once the food's gone, when everybody else is ready to go home, we're going to stay until they're done, because we want to make sure that they, when they're ready to leave, that they can stay until then. Something kind of partners with that, because we realize that we do have students that are in need. We partner very closely with Marcy, and to provide things that our students may need that we may find sleeping in their car, because typically we're going to be the ones to find them in the decks. Maybe they're sleeping in their car, especially during the winter. So all of our officers are equipped to provide hygiene kits, prepackaged clothing, as well as blankets to students who may be in need, and also provide care center information to those students. And so one thing real quick, so our officers also carry naloxone. So if you are on campus and you have an hour of your time to give, get on there and go see Lindsay about getting that free naloxone kit, because typically it's like $50 to $75 when you get a prescription from your doctor. And this is not for individuals who may have folks in their family who might receive treatment with Lindsay. But also if you have elderly people in your home who may have been prescribed medications over the years for pain, people become, their tolerance builds up. They may have to take more. It may be a thing where they need it, or you may have to use it out in the community if you work in a public setting. So I just encourage your student to come get it. You're never going to wish you didn't have it. You're always going to be grateful that you do if you ever had to have it. Worst case, you never use it, but it's an hour of your time, and it's definitely worth it. So.
And then for CARE, our signature event is about to come. The first full week of November is Homelessness Awareness Week. This is the 14th year. All y'all body heads, because we've been doing the planning for months. So we have about 11 different events that happen during that week. One is happening right now. You saw the students down there participating in the Power Hour and turning in their recyclable Coca-Cola bottles. Every bottle donated, a nickel comes to CARE, because all the services that we provide to students, all that cool stuff I talked about, is not paid through any of your tuition dollars or state dollars. Those are all donated dollars. So we function like a nonprofit. So I was cheering along all that line, because that meant those are dollars that are coming back to the KSU's CARE services, so we can help our students. It's an opportunity for students to be engaged, but it's also an opportunity for the community and parents to be engaged. A lot of people enjoy our Empty Bowls event. Look at and so tickets went on sale, and we had a rush already. We only have 200 bowls. I don't think we're going to make it to the end of the month. They're going so fast. But those bowls are made by our KSU students in partnership with dining services. They make the vegan pho or chutney that we eat during that event, and you learn about, it's an educational event about food waste and how we waste food in America, and different ways of relooking at how you use and eat and buy your food. So all that happens during that week, and we end it with a beautiful event where we sleep out in honor of one night for those who sleep out every night, but we also honor those in Cobb County who have died, who were homeless themselves. So there's a lot of different opportunities to partner through that. Also, every month we do Care About, and so we have different topics. Our Americorps Vista, Mandy leads those, and so it's financial aid, it's about stress, and it's about taking care of yourself and different things of that nature. So different topics throughout the season, but we also partner with, like for our financial one, partner with financial aid and Ward Done Charities. because we want to make sure they know what different scholarships are out there, different things like that. And then we also do really cool things where we adopt our students. So when homeless and foster care students come here, we get them adopted. And so a lot of people in the community enjoy adopting those students because every student doesn't have a parent. So I don't have a lot of parent conversations, but all my students, most of my students don't have parents, and so we become their family, and so parents are adopting them. So like we just did their semester care packages, and so all of them got their care packages adopted so that they can have something special to get through midterm exams and stuff like that. So what's cool? Everything. I think it's cool that the care has. I'm very particular. I always say, I have my team knows. I always say cute matters. So I try to make sure everything we do is special. If it's not good enough for me, it's not good enough for my students. So we make sure that when our homeless and foster care students move in, we have partnerships. This year, Haverty's donated. We have 2 houses on the Marietta campus, and so our guys' house got really cool man cave donated to them from Haverty's, and so it's really special when you have students who come from what they come from, see what they've seen, to come in and have pillows and sheets and everything they wish for sitting on their bed waiting for them, and then also to have their own man cave. It was really cool this year. We have one student, he has a really special pork chop recipe that he wanted to also try on steak, so we got to get Cisco to donate them steaks. And so they got to have steak dinner. So that was really cool. So that's the cool stuff. We try to make sure that we give them memories. So we're actually doing the family wall in the houses because we're their family. They don't go home. We are their home for a lot of our homeless and foster care students.
Before you pass the mic, as you guys pass the mic back, say your name one more time and the department that you represent.
Okay. Again, Marcy Stidum. I'm the founding director of Care Services. And if you ever need us, want to come work with us or be a part of our program, we'll be happy to have you.
Sergeant Charles Dickens with Kennesaw State University Police Department. That's also the Department of Public Safety.
Jessica Aguirre, I'm with the Office of Victim Services under the Department of Public Safety.
And I'm Sheri Grebel, Director of Health Promotion and Wellness.
Tara Parker, the Department of Sports and Recreation, and I'm the Executive Director.
Julie Fritz, and I'm with the Student Health Clinics.
Dr. Josh Gunn, Counseling and Psychological Services.
Lindsay Montgomery, Center for Young Adult Addiction and Recovery.
Thank you to our wonderful panelists. I do want to give it just a couple of minutes to see if anybody here live has any questions for our esteemed group. I will kick it off with, I think the funniest thing that I heard tonight was, Julie, when you said, it's a really fun flu event. So with that, they do amazing programming. They do amazing things on campus for our students. And so we are so thankful for everything that they do. Really, this group of people touches this campus, covers it, this 40,000 plus students that we have here. It's pretty amazing.